Hello, licensed agents. This training will go over how to quote plans using HealthSherpa. Log into your HealthSherpa account and click on the tab Quote on Exchange. We are going through over different scenarios and how to quote each of them correctly. Let's look at scenario number 1. We have a person who lives in Texas and the zip code is 75060. The family household only consists of one person who is applying for coverage. Her income is $37,000 annually before taxes. She is 35 years old. She doesn't smoke tobacco and she is not pregnant, so we will leave these two boxes blank. The estimated savings, which is the tax subsidy, will show up on the right. It is important to note that this will show an estimated quote based on age, zip code, income, and household size. You will now see the various health insurance options available for the client as you scroll down. You will see the details of each plan, such as the deductible, out-of-pocket max, monthly premium. You can use these filters, such as carriers and metal levels, to select specific types of health policies that the client wants. For example, she wants to see health insurance plans from Molina. Click on Molina Marketplace, and you will only see the Molina plans. Let's look at scenario number 2. A family lives in Chicago, Illinois, and their zip code is 60527 in Cook County. The family household size consists of 3 people, but only 2 of them are applying for coverage. The household income is $36,000. The primary's date of birth is January 19th, 1975. Gender is male, and he is a tobacco user. He has a wife, so we will click on Tab, Add Spouse Applicant. Her date of birth is August 24th, 1973. She doesn't smoke tobacco, and she is not pregnant. The happy couple has a son. Click on Tab, Add Dependent Applicant. His date of birth is June 4th, 2008. He currently has Medicaid, and he won't apply for coverage. You click on Box, Eligible for Other Coverage. This question will pop up. You select the blue tab, I understand. The subsidies only cover the husband and wife. You can remove the child from the quote, and the subsidies stay the same. Click on Tab. Delete to remove the child. Make sure that the household size equals to 3. As you can see, the subsidies still stays the same. Let's take a look at the same scenario, but this time, the child being denied Medicaid. Click on Add Dependent Applicant again, and enter the child's information. You will leave the box Eligible for Other Coverage blank. Then, click on Box Medicaid, Denied or is ending. The subsidies are updated to cover the entire family. The whole family is eligible for marketplace coverage. Let's look at scenario 3. Let's remove the information from the previous scenario. The family household lives in Oklahoma, and their zip code is 74332. The family household size consists of 2 people. They live in County Mays. The household income is $30,000 per year. The husband's date of birth is August 15th, 1955. Gender is male. He doesn't use tobacco. The wife's date of birth is July 20th, 1957. Gender is female. She doesn't use tobacco. She's not pregnant. They are naturalized citizens, and they have been living, working in the United States for 7 years. Most of the time, when you have someone over 65, they are not eligible for Marketplace, and they will instead qualify for Medicare, which is not done through the Marketplace. In order to sell Medicare, you must be certified to do so. Every now and then, someone over the age of 65 does not meet the qualifications for Medicare. For instance, this couple has only worked in the United States for 7 years. The minimum to qualify for Medicare is 10 years. Another qualification is they must be U.S. citizens to qualify for Medicare. However, this couple qualifies for marketplace coverage. Make sure they aren't eligible for any other coverage, or they don't have an active health insurance policy. Let's look at scenario number 4. The family lives in Texas with zip code 77429. The family household consists of 2 people. They don't want to apply for subsidies, so we don't need their income. However, in order to quote the plans without subsidies, you need to enter a very high household income, which would ensure the subsidy on the right doesn't show up. The husband's date of birth is December 14th, 1987. Gender is male. He doesn't use tobacco. His wife's date of birth is October 29th, 1982. Gender is female. She doesn't smoke tobacco, and she is not pregnant. The result will show the original plans without subsidies. That's the summary of how to quote plans on HealthSherpa. Thank you for choosing us as your general agency.